It isn't easy for anybody to be admitted to hospital, but it's particularly scary for people with diabetes. We knew that, and we also knew that inpatient care in Scotland had to improve, and that's why we campaigned for a programme to happen in Scotland, and that programme is Think Check Act.
Hi, my name is Susan Montgomery. I'm the Senior Charge Nurse in Ward 9A at the Queen Elizabeth University Hospital in Glasgow. We started using the Think Check Act shortly after the hospital opened, and it's benefited us in a number of ways. First and foremost, it just helps nurses to think more about their management of diabetes. It applies a standardised approach to how we all deal with our diabetic patients, and it's now became part of the policy and protocol of how you manage diabetes.
We found that non-specialist staff were not confident at treating hypos in hospital, and they were not able to manage and administer insulin, and this meant that patients with diabetes weren't confident in their care when they were in hospital. That's why nurses like Susan doing Think Check Act are so important and integral to the care that patients are receiving.
The think part of Think Check Act is really just a prompt for the nurse just to use our knowledge to the best of our ability. The check part is really just about referral criteria, about whether you should or whether you should definitely or whether you should consider referring the patient on to the diabetes service. And the ACT part is really what you would do in practice if there was any issues, if your patient had a hypo or a hyper episode. So this is our hypo box, and like I say, if a patient had a hypo episode, the nurse would come to the hypo box. As I say, standardised approach. It's got the treatment algorithm, the best way to manage the hypo for a mild, moderate or a severe episode, and it's got very clear instructions about what you should do. So we would use glucose tablets, or we would use the glucose drink for a mild hypo where the patient was able to swallow. For a more moderate hypo where the patient is unable to swallow, we would use the gel, and that's fine. So we would just take that to the patient, treat the patient, and the hypo box has the content stock list on it, so it's always well stocked. Now we're using Think Check Act for the management of diabetic patients. It makes the whole process much more straightforward. The standardised approach, the protocols, the education, the management of a hypo, it makes life so much easier for the nurses, and the patients benefit by getting the best care.
We've seen some fantastic results from Think Check Act, a reduction in hypos in hospital, but also a reduction in the time to treat those hypos, and patients and healthcare professionals are seeing the benefit of that. It's a great start, but we want to see that for every patient and for every healthcare professional to be able to deliver that care.